Gastrointestinal issues are relatively common among patients with intellectual or developmental disabilities, namely autism spectrum disorder, or ASD. There are studies that suggest that up to 70% of patients with ASD may experience GI symptoms such as constipation, diarrhea, or abdominal pain. While the exact reason for this association are not fully understood, some researchers believe it could be due to factors such as altered gut bacteria, dietary sensitivities, or sensory processing disorders. In the context of autism, there's developing research that is trying to understand the connection between the brain and the gut. The brain-gut connection refers to bidirectional communication between the brain and the gastrointestinal system. Several factors are believed to influence the brain-gut axis, including gut microbiota, the immune system, and neurotransmitters. Patients with autism may have alterations in their gut microbiota, which could impact both GI function and neurologic processes. Changes in gut microbiota have been associated with behavioral symptoms in autism, so it's important to rule out any undetected GI issues when working with a patient that may have unexplained behavioral challenges. Constipation can be a great source of discomfort for anyone, but when coupled with a nonverbal patient with behavioral challenges, this can be difficult to identify. For this reason, it's important to rule out constipation as a cause of any behavioral challenges when working with an IDD population. Alterations in gut motility, the movement of food through the digestive tract, has been shown to be slower in patients with autism. Some patients may have restricted diet or food preferences which lack sufficient fiber. Medications commonly prescribed to IDD patients, such as antipsychotic or SSRIs, may exacerbate GI issues. Dysregulation of the immune system, including inflammation in the gut, has been observed in some individuals with autism. Immune dysfunction can contribute to GI symptoms and can influence brain function through immune-mediated pathways. Neurotransmitters produced in the gut, such as serotonin, play a role in both GI function as well as mood regulation. Alterations in neurotransmitter levels or the function of the gut can affect brain function and therefore behavior in those with autism. Understanding the connection between these factors and how they contribute to both GI issues and autism symptoms is an important consideration when working with patients with autism. Targeting the brain-gut axis through interventions such as dietary modification or behavioral therapies can be effective strategies. However, there's still more research that needs to be done in these areas. Managing the GI needs in patients with autism often involves a multifaceted approach, including dietary modification to increase fiber intake, adequate hydration, regular exercise, and behavioral strategies to address sensory sensitivities or communication challenges.